Hi, my name's Tim and I'm from Shen Health. Today I'm going to introduce you to the many wonderful, fantastic things about Chinese medicine has to offer. Welcome to a guide to how to apply acupressure. Today we're going to be working with someone who we've already diagnosed, and we're going to be applying acupressure techniques in a way that's going to help her diagnosis. This is Charlotte we're going to be working with today, and we're going to be working with a basic diagnosis of blood deficiency, which is with a few little complications. Okay, we're going to work with large intestine 4 on both sides. So we're going to find the soft bit between the index finger and the thumb and the web margin of the hand. And we're just going to work with a simple Rofar technique. And we can feel the point feels a little tight. So we want to work here until the tension releases and we have a sensation of warmth and flow in the point itself. And at the same time as doing this, we can work on the same hand, and I can stimulate a point called Large Intestine 11, which is just before the crease of the elbow, just on the outside crease. And we're going to work with both of these at the same time. And both feel fairly tight, so we can see that there's probably a little bit of stress here, and there's probably a little stagnation of the qi. Alright, so as time is short, we'd normally do about 5 minutes on each of these. And then we'd do the other side, but in this case we're not going to. And I feel that large intestine 11 is done, so what we're going to do is we're going to release that and continue working with large intestine 4. And if you could just take your shoe off, and if you'd like to bring your foot up and rest it on my neck, we're going to work with a point called liver 3, which is between the first and second bone in the foot. And you'll find it very quickly because it's a very intense, strong point. And these 2 points work very well together, and they're very good for leaving stress and tension, particularly stagnation of the qi of the body. You know that there's stagnation of the qi of the body when you can feel a tenseness and tonicity of muscles in the body that you can't release. So very often neck and shoulder tension. So very good points for releasing neck and shoulder tension. Now, some people feel a heaviness, some people feel a fullness when you stimulate these points, some people feel a tinglingness, others can feel a minor ache. Is there anything particularly you're feeling?
I can feel the tingliness that you were talking about.
Does it radiate or move anywhere?
A little bit.
Okay.
Yes.
So what we're going to do is just continue working. We normally would do these points for another 5 minutes. And then we're going to put these down, and we're going to work on the neck, and then we're going to finish off with the back. Okay, we're now going to turn around and work on the neck and on the back. So if you'd like to turn around. So there's 2 points just on the back of the neck here. And again, we can work with just stabilizing the head, and we can work at both points at the same time. This is called Gallbladder 20. And again, we're finding a fullness and a tightness here. So what we need to do is just disperse these areas and pluck across those muscles in a nice, gentle way. And in this case, what I'm going to do is I'm going to do a little bit of nafa to just disperse these points. So with nafa, we're going to pinch the skin a little, lift it up and let go. Pinch, lift, let go. Pinch, lift, let go. And again, you can do this for 2-3 minutes. With more dispersing techniques, you usually use slightly less time. And we're going to work on a point on the top of the shoulders here. And we're going to do a similar technique to start with. Sorry, we're going to take this scarf away. There we go. And we're just going to work. And we'll find the point sort of halfway between the spine and the edge of the shoulder. Just on the top of the shoulder. And you want to do it until the point looks red, as you've invigorated the blood in the area. Now the last 2 points we're going to do is just on the back. So here we're just going to count the vertebrae down. And it's halfway between the edge of the shoulder blade and the spine, and we're just going to use gentle rotational techniques, and these are the points we're going to be tonifying. So we'll use slower techniques with the Rofar. Acupuncture has a slight advantage here because we could put all of the points in straight away, and she could feel the benefits of all the points in all at the same time. But in this case, as for yourself, you can do this for your friends and your family, and you don't need to have any particular equipment or licenses to do it. And then we're going to move to the next point. And this is how to apply acupressure.